Okay, excellent. Okay, so welcome, Dr. Lauren Holley. So Lauren was raised in Brisbane, Australia, where she completed her veterinary degree at the University of Queensland. She was always interested in large animals, particularly horses, and it was here where her love and passion for internal medicine grew. After graduation in 2019, Lauren relocated to the United States, where she completed an 18-month rotating internship at Rhinebeck Equine in New York. She continued to learn and grow under the incredible team at Rhinebeck Equine, gaining skills in reproduction, surgery, anesthesia, sports medicine, and field medicine. Most importantly, her love for internal medicine continued to grow under the guidance of Dr. Laura Jovsiskas and Dr. Courtney Pope. Lauren has a keen interest in respiratory and neonatal medicine and is currently in the second year out of 3 years in internal medicine resident at Tufts Large Animal Hospital. Additionally, she is currently doing research on the respiratory microbiome and the potential role it has in respiratory diseases such as equine asthma. And she's working under the mentorship of Dr. Mazan and Dr. Benedis. So welcome, Lauren. Thank you for being with us.
Hi, thanks for having me. Great, so I will get started. I'm just gonna share my screen, so hopefully everything goes well from there. Okay, so everyone can see my screen, I'm guessing. Great. All right, and as we said, I will try and monitor the chat as well as things come up, so hopefully I catch that. But as Mary said, I'll be chatting to you guys about the equine respiratory tract. So we'll go over a little bit of, anatomy and function before going into some common performance limiting diseases and just some general respiratory diseases before then going into a few other things. But feel free to ask questions throughout. I will ask questions as well. If you know the answer or just want to try, feel free to chime in, but otherwise I'll just continue if you don't. Great. All right. Perfect. So just as Mary said, I graduated from the University of Queensland in Australia in 2019. That's why I sound a little bit funny, but I've been in the US since January 2020. So just before COVID hit, I moved over, which was a little bit of an experience for me as well. So I did my rotating internship in Rhinebeck, New York, and I've kind of stayed in the area to come to Tufts here, where I'm, about halfway through now for my large animal internal medicine residency as well. So throughout this time, I have seen a large number of species, obviously lots of horses and lots of donkeys, but I also see a lot of goats, a lot of sheep, a lot of cows, a lot of pigs, all of which, plethora of different diseases, but I do have a long love for respiratory medicine as well. Okay. So just before we go into everything, I'm just going to do a little brief on respiratory anatomy. So here there's two main pictures with the human and the equine respiratory tract, particularly starting with the upper respiratory tract. So we've got the important structures such as the nose, the pharynx, the larynx, and the trachea. So as you can imagine, the nose portion of a horse is a hell of a lot longer than our nose. Same with the trachea. Obviously, they've got a really long neck. And then what horses also have, which is technically part of the respiratory tract, is the guttural pouch. While it doesn't actually play a role in, breathing or gas exchange, it is quite important for things like vocalization and brain cooling and air warming. And some diseases of the guttural pouch will actually affect the respiratory tract and the horse's ability to breathe as well. And then we moved on to the lower respiratory tract, which is, I guess, in my mind, the more fun part. But the lower respiratory tract, as we move past that trachea, we go into branches into like a tree-like structure where we've got the bronchi. So those are the bigger tubes. Then they'll branch into the smaller bronchioles and further reaching the tip where they get to the alveoli, which are these little, I guess, like bubble-like structures at the end. So if you look at 7 there. And that will be where the main portion of gas exchange occurs. And then the diaphragm is a really important part of the respiratory tract, even though it is a muscle that separates the thorax, so the chest, from the abdomen. It plays a crucial role in breathing and everything like that. All right, so a little bit of lung function. So the main function of the lung is gas exchange. So basically us breathing in oxygen and breathing out carbon dioxide. But it does also play a number of important roles in, getting air to the right temperature and getting it to the right humidity. So moisturizing it as well. And the upper airway is really important in this role. And it also protects the lower airway from particular, larger particles or pathogens, and filtering out these harmful substances that go to the lungs by other mechanisms such as coughing or sneezing, or even, bringing something up and swallowing it. And it also is important in supporting your sense of smell. But why is gas exchange so important? That is because oxygen is basically needed for every sort of function we have in our body. So all our cells, everything we do requires oxygen to work. And as a consequence of this, the cells also then produce carbon dioxide. So we need to keep continually getting oxygen to our cells and need to keep continually removing that carbon dioxide, which is why the lungs are so important. So the alveoli, those small little bubbles that we get at the end, are the smallest but the most abundant part of the lungs. And in humans, it makes about 1,400 square feet if you lay them all out flat. But in the horse, it's about 26,900 square feet. So it is a large surface area, which is why they can, exchange all this oxygen that we need for our normal functions. So the alveoli, those little bubbles, are surrounded by tiny, very thin-walled vessels called capillaries. And this is where the gas exchange occurs. So oxygen moves out of those little bubbles and into the bloodstream. Carbon dioxide will then move into the alveoli to then be breathed out. And how this happens is as I said, these walls are very thin and there's a bit of a blood gas interface where the process of simple diffusion occurs. So if you remember back to, I guess, like biology in high school, if you haven't got there yet, I'm sure you will learn about it. But basically diffusion is where you've got something which is in abundance moving to an area where there's less of it. So from a high pressure to a low pressure. So as we breathe in, we have a lot more oxygen in these alveoli. So it's going to move out of the alveoli into the bloodstream where there's less oxygen, and vice versa. So as we see here, this is just a simple schema for diffusion. We move from an area where there's lots of little bubbles to an area where there's not a lot, until we reach about an equilibrium. So this is exactly how gas exchange occurs, and then travels around the body within the red blood cells as well. So lung volumes, before we get on to how breathing occurs, does anyone want to have a guess at what the, I guess, maximum amount of air in liters or gallons that the human lung can take versus the equine lung? Right, that's okay. So the healthy horse, so the human, can breathe a maximum about 6 liters, and normally at rest we breathe about 500 mils per breath, whereas the horse is about 55 liters, where there's about 5 liters at rest. Obviously, they're a lot of a larger animal, but scale-wise, it is quite a lot. I would just like to note that they don't rarely ever reach this maximum capacity of 55 liters, and more so, get to a maximum of about 40 to 60 liters. So, even though they can breathe more, we tend not to reach that maximum capacity. Human and horses' respiratory rates are quite similar. So humans are about 12 to 16 breaths a minute, and horses are about 8 to 16. So that means in a full minute, a horse can breathe at least 60 liters, whereas a human will be about 10. So this is, kind of puts into perspective how much they need to process and how much oxygen is needed to run their body. So for breathing, in order for us to pull air into our lungs, we need to change the pressure within our lungs. And in order to do this, we need to have the higher pressure on the outside, so in the air, compared to what's inside. So in order to decrease the pressure in our lungs and draw air in, we need to expand them, so increase the space that we have. So this is done by the ribs moving outwards and upwards through the contraction of some of the intercostal muscles between your ribs, as well as the diaphragm, so that important muscle that we saw at the bottom, and that one here, going to contract and pull everything down and push everything towards the abdomen. So that way we're going to expand the lung and pull air in. And that's how we breathe in. And then when we exhale, those muscles of the diaphragm relax. It's almost like a recoil that recoils up. And then certain intercostal muscles, different ones from breathing in, will contract and push the chest inwards. Normally breathing out is a pretty passive movement. It doesn't require much energy unless we have those forceful expirations where we're going to push air out. But otherwise it's more of just a recoil to move everything up. So airway resistance to airflow has a direct relationship with the energy needed for respiration. So the greatest resistance occurs in the narrowest part of the respiratory tract. So there is, rate limiting steps here. So the upper airways is, and particularly the nostrils and the larynx, so that area that we spoke about before, and I'll come to in a bit, is the rate limiting step because there's a lot of airway resistance there. So during exercise, the airflow resistance is reduced through flaring of the nostrils and also opening up the larynx through the horse, extending their neck out. So the horses want to have more of an outstretched neck to produce those higher levels of energy needed for higher levels of work, basically. So as you can see here with the thoroughbred racehorse up the top, they are trying to stretch out their neck to run at those really high speeds as well. So, so the horse's respiratory rate reaches about 180 breaths per minute at maximum when they are galloping, and that's because they obviously need to increase the oxygen demand to the cells for aerobic or oxygen dependent metabolism, as well as also getting rid of all that CO2 from this metabolism as well. At the start of intensive exercise, horses will undergo what's called anaerobic metabolism. So that's a non-oxygen dependent metabolism, but it's really only short-lived. And that's how you get those short bursts of energy at the start, because your body is going to use up what it has before going to that oxygen dependent sort of mechanism. So as I said, horses will drastically increase their respiratory rate to up to about 180 breaths per minute. And as you can imagine, the forces on the ribs and all the other respiratory muscles can fatigue quite quickly. So how does a horse do this? So they have quite an interesting mechanism. So at the canter or the gallop, and to a lesser extent the trot, the respiratory rate is coupled with its stride rate. So the mechanisms of locomotion, so they're moving, control the breathing as well, which is quite a unique adaptation of the horse. And this is called the locomotor respiratory coupling mechanism. So this basically minimizes the amount of muscular effort that the horse needs to make for breathing and allowing them to expend it in different areas, such as their movement. So it's the forces that are associated with the weight bearing of the forelimbs and the pressures of the abdominal organs and the on the diaphragm and the body's, position in space as well. That kind of, helps with this mechanism. And this is most effective at the canter or the gallop, where there's about a 1-to-1 ratio between respiration and strides. So for every one stride, there's about one breath. Whereas at the trot or pace, it's a little bit more flexible. Again, they don't need as high respiratory rates because their oxygen demand is lower. So you get more of about a 1-to-2 ratio, 1-to-3, or even about a 2-to-3. And this basically works is as the forelimbs hit the ground, as you imagine, their shoulders kind of compress their chest a little bit, helping them expire air. So they push that air out. And when they push off, they also open it up to try and expand the chest. And at the canter and the gallop, it's more effective because those forelimbs are going to hit the ground, in close succession or at the same time. So you're going to get that maximal sort of effort. And in addition to this, because of the rocking back and forth of the abdomen or the body of the horse, you kind of get that movement of the abdominal muscles pushing against that diaphragm and pulling it back and opening up the chest. As you can imagine, maybe, a ball in a bathtub or in a thing of water, and if you rock it back and forth, you're going to create those waves. And that's essentially what the abdominal organs do for the chest as well. So overall, this reduces the amount of energy needed for breathing and allows the horse to perform at really high levels. But it is important to note that with a change in stride length, so either going from the canter to the gallop or downward transitions, it'll take several strides before the horse catches up to the new rhythm. And it also means that horses with longer stride lengths can breathe more deeply, making it easier for them to maintain higher speeds for longer distances. But I think this is a really, unique and cool mechanism that the horses have to help them breathe and perform at such high levels. All right, before we, I guess, take a little break for something else, I just wanted to talk about some of the defense mechanisms of the respiratory tract before we get into some of the issues that the horse can have. So the upper airways, and particularly the nose, is the first line of defense for removing airborne pathogens or large particles. And basically how they do this is they regulate temperature, and they also have these tiny little microscopic hairs called cilia that can essentially move pathogens around and towards the end of the nose and can be sneezed out. And then they also obviously act as a physical barrier, particularly the larynx for the lower airways, which is what we have in this picture on the right here. So this is looking down the horse's nose basically, and this is the larynx here. So we have what we call our arytenoid cartilage, our trachea, so going down to the lower airways is here, and our esophagus sits up the top here, and this is the epiglottis. So being able to protect the lower airways by closing this, so when we're swallowing or when we're eating, those close there, and the epiglottis flips up to direct food into the esophagus. But as you can imagine, this is quite close to this hole. So there are a couple of things that, affect that. And that's, the main function of the upper respiratory tract is that physical barrier. The lower airway has a very similar defense mechanism to the upper airway with those tiny hairs called cilia, but also what it has is this mucus mechanism where the larger particles and bacteria and pathogens get caught in that mucus, and that cilia basically move it up the trachea to be coughed out, sneezed or swallowed later. So the lower airways is constantly being exposed to bacteria, it's constantly going in, and it's really important that they have that ability to remove it to protect that lower airway, which is why when we get impairment or dysfunction within these mechanisms, that's when we get other infections occur, such as pneumonia, and we'll go into that a little bit. Also, the immune system is obviously quite critical in removing these pathogens and recognizing them. But the immune system, unfortunately, is not without its flaws. And again, we'll come back to this because it is important in one of our common respiratory diseases. Oh, there's a question. All right. Is it more common that racehorses have trouble breathing? I guess that's a little bit of a loaded question. They obviously have to perform at much higher levels when they are racehorses, but thoroughbreds, in particular, I think to a lesser extent standardbreds, do have a couple of other genetic factors that do play a role in this. So they can, and we'll go into some of these diseases in a bit, they can be more predisposed to some conditions that will make them have trouble breathing. And the other thing that I think it makes us think about thoroughbreds being more affected is because they're performing at such high levels, it's probably some of these problems are more commonly recognized. Asking a horse to, do what we ask thoroughbred racehorses to do is a lot different than say, eventing or anything like that. It's a different level of energy expansion that's needed. So maybe it's a little bit more diagnosed. I think that lower levels of work are much more tolerant of some of these issues, which is why we see it a lot more in thoroughbreds. I hope that helped. But we will come back to some of those, and maybe it'll also be answered a little bit later. Okay, so now before I get into some of the diseases, I'll transfer back to Mary to do a bit of a raffle.
Yep, sounds great. Okay, so just really quickly, again, thank you to Trafalgar Square Books. And let's see here, you have to be on the call. So let's see, to pay attention to who's on. So there's an Adelie Tuman. Is there an Adelie on the call? No, I don't think so. Right. Let's see, Catriona, Cleveland. Nope.
Hi, that's me.
Oh, you're here. Yes, excellent.
Yeah, Nina.
Catriona.
Yep.
Okay,
Yep.
beautiful. I will email you after the call.
Okay, great. Thank you.
Thank you.
All right. Oh, sorry. Just 1 second. Okay. So now we're going to get onto some of the conditions that can affect the airway. So I'm going to try and focus on things that are more, performance limiting, but there are a couple of other things I do want to chat about. There are some videos in this. I don't think anything is particularly graphic, but I think there's very little to no blood or anything like that, but just to warn people, there are some videos of some of this anatomy. So we'll briefly just go over some of the quick ones before we get into things more in depth. So starting with upper airway conditions. So with the nose, we have a lot of congenital conditions that can affect breathing. So this is a foal with rhinos. And as you can imagine, that is going to affect your airflow and your ability to take in air efficiently, because it's got to go through this, bit of a turn. And you also get different variations of this with deviated septums and stuff like that that can also affect turbulent flow through the nose. Otherwise, you get things like ethmoid hematomas. So if any of you have ever had a horse with an ethmoid hematoma, basically what happens is the ethmoid is this little thing here within the nose, all these little structures that for some reason or another, they get a bit of a blood-filled mass within there that can occasionally make them bleed from the nose. Sometimes it just starts with a trickle, and sometimes it can be a lot of blood. But obviously, if you're having bleeding from the nose, this is one of the main things that we think about. It's not necessarily affecting the performance, but it obviously affects the horse's life. Then we have some other structures within the sinuses. So the sinuses sit basically past the nose here and above those ethmoids. So that's the ethmoid there, and the sinuses come out from the top. They are air-filled structures, not necessarily important in respiration, but they can get a number of issues such as cysts, which will cause, secondary nasal discharge or anything like that. Primary sinusitis, so primary infections, those are kind of rare, and they're often more actually associated with tooth root abscesses. So what we see here is these molars and premolars are really close to these sinuses, so their roots come up quite close. So if they get a tooth root abscess, you often get a secondary infection within the sinus, and then you're going to get that nasal discharge coming out of the sinus here. So that's that nasal discharge there. And obviously they can get a bunch of different tumors and stuff in there too. And then the other thing I did want to chat about is the guttural pouch. So I know I mentioned that it isn't necessarily important for, gas exchange or breathing, but it does certainly have a condition that does affect the horse's breathing. Does anyone know any? It's a very, common and quite infectious disease that can affect the guttural pouch. Does anyone know what that one is? Cool. So that is strangles. So strangles is obviously something that is, really important to vaccinate for. And it is a condition where basically they get abscesses within their lymph nodes under their throat latch that basically rupture into the guttural pouch. So this is the guttural pouch here, and this is this big lymph node underneath that will then burst into it and get all this purulent material or pus in the guttural pouch, and will cause them to have nasal discharge. If the material sits in there too long, it does develop these things called chondroids, which is why they can be prolonged shedders. Vaccinating is really important and reduces their clinical signs, because really the biggest thing that is the biggest sort of consequence of strangles is these big abscesses can affect the larynx area and actually compress the airway, making it difficult for the horse to breathe as well. All right, so now we're going to get onto some of the more poor performance issues associated with the larynx. So again, we're touching on a little bit of that anatomy for the larynx. I'll just remind you, we've got the arytenoid cartilage here. We've got the trachea here. This is the epiglottis, and we've got our esophagus here. So this is just a bit of a diagram. So this is our trachea in here. So this is a normal endoscopic, so a video examination coming from the nose into the larynx and into the trachea. So I'll try and talk through that a little bit, and hopefully the videos work well. So this is us coming through the nose of the horse. So going through all these little turbinates and little kind of holes that they have. You know, the scope is normally only about this thick, going through the nostrils. Some horses are much better at it than others. So we're moving through there. Sorry, it's just there. All right, so now we're getting into the pharynx area. So this is the pharynx up here. We're coming into these openings here are the openings to the guttural pouches. So if you get discharge, it comes out there. And then here we're getting to this larynx area again. So there's arytenoids, the trachea, and the epiglottis. And as you can see, when they breathe, these arytenoids move back and forth, and almost they can, you know, close the airway completely, which is that protection sort of mechanism. So now we're going to dive down into the trachea. You've got to time it a little bit. So we move down. This part might be a little bit rocky, but you can see as we move down, we kind of get these little bumps, and those are the tracheal rings that we're passing. But this is quite a normal trachea. There's a little bit of mucus down here, which is probably the most abnormal part about this scope. But otherwise, you know, the trachea is really clean. It's not red or anything. It's just got that extra mucus. And this is where we're getting down to the bronchi, but I will come back to that for another video. So that's a sort of normal upper airway and trachea exam. So now we're moving on to some of the issues with that. So one of the issues that we get that affect performance is what we call dorsal displacement of the soft palate, which is basically where this picture on the right here is what is normal. We get the movement of this area underneath. So that's the separation between the mouth and the nose and the back of the throat that comes and flips up above the epiglottis here. So that's why we've got this here. So that is flipped up above this. And as you can imagine, that affects breathing and kind of causes a bit of like a gurgling sort of rattling noise as they breathe out, because all that material kind of flaps around. So you kind of get that gurgling noise. Normally horses swallow and it'll go back to normal. But if this is something that's more persistent, then it can be a bit of an issue. This is quite common in race horses and some sports horses, and it's rarely like a permanent issue. It's normally intermittent and during exercise, but certainly can be performance limiting because you are going to get changes to the airflow and the efficiency of the airflow down into the lungs. This is diagnosed via endoscopy, so this video here, and it has about an 82% resolution with the tie forward surgery, which is basically where we grab this epiglottis here and pull it forward to stop that soft palate from going above there too. So this is a video of the dorsal displacement. It's a little bit dark in here. They didn't get much further in, but as you can see, you're kind of not getting that nice smooth edge of that epiglottis there. This is probably the worst video I have, but you're not really getting that epiglottis there, and you're just getting this smooth sort of material between. All right, another sort of issue that affects performance is epiglottic entrapment. So again, this picture here on the left is normal. We've kind of got these bumpy bits and these vascular bits. And what happens is this material underneath, this little membrane, flips up above and kind of engulfs the epiglottis here. So again, not necessarily when they breathe in, but when they breathe out, they get that sort of rattling or gurgling sound. And this one is, you know, something that's happening all the time. They can't replace it while they exercise, but so it can be performance limiting, and it needs to be fixed, and the horse can't do it on their own. So how do we fix that? Is we basically either get a hook and pull this off, or we actually laser down the middle to reduce that tissue. If it stays entrapped for a long period, they do get little ulcers and stuff underneath, which inflames the tissue and causes them to increase the risk of repeat entrapment as well. But otherwise, it's common in race horses and in endurance horses as well. But with surgery, it's got a really good prognosis as well. So this is an epiglottic entrapment here. So you've got that tissue around this little epiglottis here, and you can almost actually see the little ulcer when it goes in a little bit. You can see an ulcer forming there, but otherwise the tissue has flipped up over the epiglottis. So that's a normal epiglottic tissue in there, and that tissue is flipped up. And then this is maybe one of the more graphic videos, but this is the laser procedure to try and get this out. So you just have to keep lasering this. The horse is awake while we do this. So, you know, they're sedated, and we just have to keep lasering to remove that tissue to free the epiglottis there as well. And normally they respond really well to this. All right. All right, and probably the biggest cause of poor performance, especially within the upper respiratory tract, is laryngeal hemiplegia or RORA condition. Basically, what we have is it's a progressive dynamic collapse when they breathe in. And dynamic means is as they start to move more, they fatigue the muscles that basically pull back these arytenoid cartilages. So we get the issues there. It's more commonly on the left-hand side. So this is the left here. It's a bit hard because left is right, but this is the left here. We don't know why it's the left side, but it is more commonly the left. And this is basically makes a roaring sound during exercise, which is why it's called roars. And it's because when they breathe out, that this arytenoid cartilage here basically flaps because it's loose. Often we can't find the cause. There is a genetic predisposition in thoroughbreds, which are so obviously our race horses, but other causes can be perivascular injection, so giving bute outside the vein, trauma to the neck, or other neurologic diseases that affect the nerve function to the muscle that pulls this back. This is diagnosed again on endoscopy. When they're standing and still, some horses with lower grade won't show any dysfunction, and you do have to do what we call an above ground scope. So we place a scope within their nose into this area, and we actually get them to exercise, and that muscle is going to fatigue, and then we'll start to see that deviation. The treatment is a tie-back surgery, and what they sometimes do a ventricular cordectomy, where they actually remove this tissue here. And I do have a video after a tie-back surgery, and I'll kind of explain that. But basically what they do is they take this cartilage here and pull it all the way back so it's permanently open, so it doesn't flop in and out, basically. This has a fairly high success rate, about 70 to 75%, and it's higher in lower levels of work. So often thoroughbred racehorses that do have this issue will end up being retired if they can't perform at the levels even post tieback. But for lower levels of work, some horses don't even require the surgery because they aren't getting to those higher sort of energy expansion levels. So this is what we see on endoscopy. So as you can see here, it's asymmetrical. So this is opening and moving all the way back, and this one isn't moving. So as and I think there's a good part, as they breathe in, this one moves, and this one doesn't. So this part is basically partially paralyzed, and they've got different grades. Some of them move a little bit, it's just a bit asynchronous, and then some of them don't move at all. So this is a moderately affected one. But certainly, you know, you can really see the difference between those two there and how it's going to affect the horse when they breathe out, because this is basically going to vibrate and get that roar sort of sound. So this is post tieback surgery. So that's where this one can now move as per normal, but this one is permanently extended in this sort of position to allow for breathing. It does mean that there are some management changes associated with this. So you have to feed the horse with the head on the ground, with food on the ground and everything, so that they don't get food into their trachea, because obviously their ability to protect their airways is reduced a little bit, but horses tolerate this really well. But this is what they look like afterwards. All right, so moving on to some of our lower respiratory tract things. I'm going to show you a video here of a horse at work, and hopefully the sound is working. I'll move to about here. Can anyone tell me what this horse is doing? So this horse is coughing at exercise, which is obviously not normal. A couple little coughs here and there, as you know, their work increases and stuff is completely normal, but this horse is kind of persistently coughing. And then if I showed you these next videos and said, gosh, if it'll actually go to the next slide, would be great. Okay, so now imagine this is the same horse, but we kind of get this at rest. So either this is just immediately post-exercise or even just this horse sitting in the stall. So what we can see here is when this horse is breathing, we really get that abdominal push. You can tell that they're really working to expand their lungs and breathe properly. So you can really see them pushing basically here. And then this horse also has a little bit of nasal discharge, and you can even hear them breathing. So what this is, oh gosh, 1 second, eventually it'll work, is equine asthma. So this is another one of another very common performance limiting disease, and actually affects a lot of horses to different varying degrees. Some of the other names that we have for it are recurrent airway obstruction or inflammatory airway disease, but more often than not at the moment it's called equine asthma. And it does have a bit of a spectrum of clinical signs. So it ranges from horses that really have exercise and, oh, there's a question. Yes, he has heaves. Yeah, heaves is another word to describe it. Awesome. Yeah. So as I said, it's a spectrum of clinical signs. We get some horses that are really only affected at exercise. So when they go to higher levels of work, they start to fatigue easily, they cough, versus some horses that even just sitting in the stall, not exercising, will have issues. The way this kind of works is they're exposed to a trigger, whether this is, you know, environmental toxins, so dust or mold spores, or even allergies to things like summer pastures, although this accounts for a very low percentage of our asthma cases, or there's even a genetic predisposition in warm bloods potentially. Basically, they get exposed to these triggers and the immune system has an overzealous or an overreactive sort of response, where instead of having our normal sort of bronchi here, they get inflammation and thickening of the walls and extra mucus production. And as you can imagine, by reducing these wall size, it's going to reduce their ability for air to move through, and the mucus is also going to affect that as well. So this is one of the times where the immune system does a little bit of too much of a good job, and they get inflammation within their lower airway. So kind of similar to human asthma, and it has some sort of an allergy component to it as well. So some of the clinical signs of asthma, again, depend on the severity, but it can be seasonal. So some horses are more affected in summer, some horses are more affected in winter. It depends on what their particular allergen is. So some horses that are more affected in winter may be because they're stabled more in winter. And so they're being exposed to more dusts within the barn, versus seasonal if it's out, you know, summer pasture and outside and stuff like that. They often see changes with environment. So they're moving to a new barn, there's a little bit more dusty, or they're in a different stall, things like that. This mild disease may be associated with like coughing during exercise or exercise intolerance. So they don't want to go as much, or they get fatigued really easily, or they're breathing really heavy after exercise, versus severe, where you get the coughing at rest, you'll increase respiratory rates and effort, and even get that mucus discharge and nostril flaring. If you were to listen to a horse, either mild asthma during or just after exercise, or a severe horse normally, you will get wheezes and crackles on their lungs. So wheezes is basically what it sounds like. It's that wheezing sound as the air moves through those narrow airways, and crackles associated with them moving past that mucus and making a little bit of a bubbly sound. So diagnosis of equine asthma is basically what we do. There's a couple of things. One of them is a bronchoalveolar lavage. So that's where we put a tube down into their trachea, past into the lower portion of their airways. We put a little bit of fluid in there and we collect it up, and we look at the cells underneath to see what sort of inflammatory cells are responsible for this overzealous airway inflammation, which allows us to guide treatment. We look at the trachea to see how much mucus, and stuff is there. We do lung function testing to see how they respond to things like histamine, and how much airway resistance they actually have. And then we can also look at radiographs in more severe cases as well. So this is a bronchoscopy where we just prior to collecting a BAL. So this, we just sprayed a little bit of lidocaine into, so that's a local anesthetic to make it a bit numb, make it more comfortable for the horse, into the trachea and at the top here. So then we'll go down into the lower airways as far as we can with about a 1.5 meter scope in a horse. So we'll go down in a second. Just got to time it. All right, so now we're going down the trachea, a little bit of a bumpy ride, trying to pass it quite quickly. Again, we're putting some more of that local anesthetic in to reduce them, coughing and stuff when we do this procedure. This horse has a little bit of mucus in his trachea as well. You can see kind of like the pools there. But the more interesting part is as we get further down, there's a little bit of whiplash with this video. So now we're getting into these bronchi. So here, this is where the tree starts branching. So basically what happens is as we move down, we keep moving down through these tubes into a portion and wedge ourselves in. So you can see there's lots of tubes coming off. And this is really only reaching into the bronchi. There's a lot of horse lung that we can't access. Yeah, so that's kind of the area. And the horse can get a little bit irritated from this as well. So that's a bronchoscopy. So how do we treat equine asthma? A lot of it is environmental management. So decreasing their exposure to dust and hay spores and those potential allergens that may be causing this overzealous response. So the more turnout, the better, obviously, unless they're one of the few summer pasture horses. But more importantly, keeping them outside of the stall for greater than 2 hours after cleaning the stall, because as you can imagine, as you clean, all the dust and everything is going in the air. So reducing their exposure to these potential triggers is going to help their airway. So things like soaking the hay is also going to reduce the dust in the hay and the hay spores. You could also do steaming and having them in a well-ventilated barn, or if they're a more susceptible horse, at an end stall and no hay storage or everything overhead. And shavings are better than straw just from a dust standpoint. That is the mainstay of treatment, but there is some medications that we can use. So we normally start with oral, so by mouth, or intravenous steroids. And this is because if they are a more severe case, we have to get that inflammation down. So the steroids will decrease that inflammation before then going to inhalation therapy. So either nebulizing them steroids or things like albuterol and everything like that. So there's a couple of different products we have out there. This little donkey here is got one of the FlexiNeb nebulizers. So basically you put your steroid or whatever you're doing in that and it nebulizes it to them. The Acervo, which is a steroid nebulizer as well, and the Aerohippus, which is often used for things like albuterol, which are going to, is commonly used in human asthma. That's going to expand the airways. But these treatments really aren't enough if you're not doing environmental management sort of things as well. But asthma is one of the more common performance limiting, respiratory diseases that we do see as well. All right. Just a brief touch on, how am I doing for time? Cool. On infectious diseases. So we have a number of different viruses that they can affect, but otherwise one of our biggest ones is bacterial pneumonia or pleuropneumonia. So pneumonia or pleuropneumonia is where they actually get fluid on the outside of the lungs within the chest, and it's a more severe type of pneumonia, can be caused by things like viral infections and then secondary bacterial infections. If your horse chokes, they're at increased risk of aspirating into their lungs, or what we call shipping fever. So after long trailer rides, they can increase the risk of this. So clinical signs are, they're more lethargic, they're not wanting to eat as well, they're more dull. Some of them will get nasal discharge like this, and a lot of them will have fevers and higher respiratory rates and difficulty breathing, but some horses hide that really well, and really only the first thing we see is a fever. But this is certainly an abnormal outstretched neck stance for a horse that's just standing there too. So this is diagnosed basically on looking at our physical exam, listening to the lungs, looking at a bit of blood work, ultrasounding. So these are some ultrasound images here. So normally the lung kind of looks like this portion here, where it's that bright white line. And as we start to see these white bits coming in, it means there's less air in the lung. And even this part here, there's even less air in the lung. So we know that they aren't breathing as well into that area of the lung. So there's likely pathology. We take radiographs as well, and I'll show you some radiographs. But otherwise, we can take a little sample of fluid from the trachea and culture that as well. Or if they have fluid within the chest, we will culture that too. So this, as you can imagine, the horse's lung field is quite big. So it's a couple of radiographs to get all of it. And this area here is the particular area that we tend to see the most sort of pneumonia, because everything kind of is heavy and falls down into this area. So this is probably the most important radiograph, is this one here, or this one below here, to try and get every portion of the lung. So this is our heart here, and these are our lung in this black bit. So it should be nice and black with the airway. So when we start seeing more white and stuff, besides obviously this little tree-like structure, that's when we have issues. So treatment depends on the severity. So mild cases can be treated with oral antibiotics, and a little bit of anti-inflammatories and pain medications, so Banamine or Bute, and rest. Whereas more severe, we'll need things like IV antibiotics, anti-inflammatories, or even placement of chest drains to remove that fluid in there as well. All right, I'm going to move on to just a couple of management-y type things for the respiratory tract. So I'll just briefly touch on the normal physical exam of the horse. I think that's great to have a stethoscope available. Well, how am I doing for time? I'll quickly try to get through this, sorry. Have a stethoscope available to listen to the heart, get used to counting heartbeats, and always a thermometer is really important. So a normal temperature range is up to about a 1 and 1.5. And then body condition, and this is the area where the lungs are on the horse to listen to as well, and your heart's down here. And then body conditions really important for respiratory health. It's obviously important for overall health, but the more fat a horse has, as you can imagine, similar in humans, it makes it harder for them to exercise and harder for them to move, and affects their respiratory tract. There's a couple of other things that affect poor performance. Cardiovascular, so your heart is one of the big ones. You've also got musculoskeletal, so obviously lameness, your bones, joints, and tendons. Neurologic disease can also affect performance, and metabolic disease as well. These to a lesser extent, unless the horse is unfit from being, either too skinny or too fat as well. Sorry, I'm just trying to get through this so I can do the last bit. So exercise intolerance is mostly unwillingness to move forward, or in respiratory tract cases, labored breathing after short periods of work, or prolonged high respiratory rates as well following exercise, and really not performing to the level that they used to or that they are expected to. But it can be quite tricky to identify early on when they're in the early training phases. But as you move up in training, it should be a lot easier to identify, or if it's getting worse throughout a period. But as I said, with those things before, there's a couple of things you have to look at. So conditioning, overload is really the main principle of conditioning. So the system needs to be overloaded in some sort of manner, whether you've got intensity, speed, or time, in order to see improvements. So in order to do this and improve fitness, we need to continually increase our workload. So you are going to get those higher heart rates and respiratory rates at the start, but they should obviously warm out of it and get used to it. And as you move higher, that same sort of process will happen again. It is important to note that conditioning will improve the upper airway function, so it will help with those muscles of breathing, but it really has minimal effect on the lower respiratory tract. And the lower respiratory tract tends to be the rate limiting step in how far a horse can go, as there's really, even if you condition them, there's no really good way to change their ability to, breathe in oxygen and transport it later. But overall cardiovascular health is really important too. What else was I going to touch on? But it does, obviously have other benefits such as reducing fatigue of other muscles and everything like that, which is going to help your respiratory tract as well. There have been studies that shown about 4 weeks of conditioning shows significant cardiovascular changes, with like a lot of improvement at about 6 to 12 weeks. And as even with periods of rest, you aren't going to get a large amount of loss in cardiovascular function as well. It normally takes a few months to see changes, but the cardiovascular system is quite slow in losing its ability to work and everything like that. Sorry, I rushed through the last bit. I know we only have a couple, about 10 minutes left, but I wanted to make sure that everyone was okay and there weren't any questions.
Wow, Lauren, this has been great. I think we will give people a few minutes just to see if questions pop up. So I guess just if you are getting a horse that's new to you, if you're leasing or buying something that's new, like what would your first step be to kind of check their respiratory health for a horse that's new to you?
Yeah, so I think that's it's a good question. And really, you need to see the horse do the level of work that it has been doing, and how its training has gone. So always PPE exams are really, really important, but exercise exams within those PPEs are pretty important too, to make sure that they aren't showing signs of exercise intolerance and everything like that. You want the horse to be performing to the level that you expect them to when you buy it. It is sometimes quite difficult to diagnose certain, exercise intolerance issues on PPE exams. I think what's most picked up is, heart problems, so murmurs or arrhythmias, but the respiratory tract it can be quite subtle. So if you see the horse under work, or your vet can look at the horse while they're working, it's going to be the easiest way to see, like, okay, this horse is struggling during exercise, because if it's a mild case, them just standing there is not going to be as sensitive to pick everything up. So definitely having them looked at while they're exercising is important. I think there's a question. Why would a horse who is very strong breathe very heavily during moderate work? So I think, strength is an interesting concept for that. If they're not fit cardiovascularly, that will affect them, but otherwise they may have some of these things like asthma to a lower degree that is affecting their ability to move air in properly. I think regardless of, the horse's strength or fitness level, you really want them to be breathing to the level that you think they are. So if they're breathing heavily during moderate work, and they really shouldn't be, they may have some underlying conditions like asthma that will affect them as well. So even though they have that strong muscle strength, there will be other factors that could affect the respiratory tract that could make them breathe more heavily. How is a heart murmur diagnosed or treated? So heart murmurs are mostly diagnosed by a vet on exam. There's a bunch of different heart murmurs that horses have. There's ones that are pretty benign and don't really do much, versus ones that are more clinical. So if your horse has exercise intolerance and a heart murmur, what we recommend is them coming in, doing an echocardiogram. So that's where we actually look at the heart with the ultrasound to see where the murmur is coming from and if the actual chambers of the heart are affected. So do we have enlargement of the heart, or do we have, thickening of valves and everything like that? And treatment just depends on the severity. So there are a lot of drugs out there that can help, but often it's just, it's like anything, as a horse potentially gets older, they're have higher risks of things like heart murmurs, versus if a young horse has a heart murmur, it may be something that is performance limiting and they may not be able to get over it. But otherwise it's, heard on your routine exams, or if you've got exercise intolerance, it's assessed then. And then normally we recommend echocardiograms and even electrical ECG testing to see if there's any murmurs associated with it as well.
Okay, I don't see any more questions coming in. Oh, yes. Okay, one more.
What would you do to help the competition horse with breathing, say, during a marathon? So I guess, breathing is the rate limiting step in a lot of this. So even if they are fit, their respiratory tract can only take so much, but improving their overall fitness is going to be the best thing. So gradually conditioning them and increasing their ability to run those marathons. Obviously, I certainly cannot run a marathon without a lot of training. So it's like gradually bringing up the rest of their body, so their muscles and their cardiovascular tract to that sort of level. The respiratory tract will hopefully follow, but some horses aren't made for marathons, just like some of us aren't made for marathons. But it's all about training and gradually increasing and improving them to that sort of level. But through that, you're going to help the upper airways. But unfortunately, with improving muscle and everything like that, you are going to get some effect on the lower airways, but it's really hard to, train the respiratory tract specifically. All right, how does EPM affect breathing? So it doesn't necessarily affect breathing specifically. It can affect some of what we call the cranial nerves that affect the upper airway. So that larynx, the area I was talking about, that opens up to the trachea. So some cases of EPM will show dysfunction in the larynx or the upper airway sort of system. It's definitely not all cases of EPM. EPM depends on where the protozoal and the infectious agent gets into the spinal cord. So it depends on where that is. So not all horses with EPM will have respiratory issues, but it can be a cause of some upper respiratory tract dysfunction as well. Can you tell what type of heart murmur it is on ultrasound? Yes. So on ultrasound, we're able to see where the murmur is coming from as what valves it's associated with. So if you put the probe on the heart and you can see basically regurgitation or blood flowing in the wrong direction, that's where the murmur is coming from. So yes, we normally can determine where the murmur is coming from, especially if it is a more severe murmur. More milder murmurs, we may see some mild changes, but then normally it means that the heart is otherwise healthy and it's a bit of a benign murmur and the horse normally does quite well.
Okay, lots of questions. This has been great. So I think that might be it. Thank you very much for joining us. This was fantastic information. And I will share your email with everybody. So if anyone has any follow-up questions, I will send that out. And thank you.
No problem. Thank you for having me. And I hope it was informative.
Very informative. Thank you. Yes, this is great.
All right. No worries. Thank you.
All right. Have a good night.
You too. Bye.